Hey, welcome to Lab Rat Sherry. This is a bonus clip for this week. Why? Because lately we got a lot of news about Cyclospora outbreak. So I think this is a great opportunity for you to review some ASCP microbiology content. On your exam, sometimes you will get into the question asking you whether the patient is getting a parasite infection or a bacterial infection, since they all got GI symptoms. They all having diarrhea, they all got abdominal pain, and they all eat something weird or having some whatever travel history. And how do you know whether they got bacteria or parasites in their gut? So start with the symptoms onset. The bacterial infection normally will give you symptoms within hours up to a few days, and you develop that symptoms so fast. But parasite, on the other hand, would not be developing symptoms all the way until a week or two later. And when they do have the symptoms, the bacterial infection would give you a high fever. That's very common to have. There is exceptions. We're going to do that at the end of this video, so stick with me. And on the other hand, parasite, it is very rare for somebody getting parasite infections to having fever. Even they do, it's often very low grade. Most of this patient would get diarrhea, but in a bacterial infection, the diarrhea is often more watery and it's bloody and sometimes mucus-like. The parasite infection would give you more of a greasy stool and the smelling is worse. And then comes to the laboratory test. The biggest difference, almost like the absolute golden rule for differentiate these two different types of infection, is the reading of white cells. The WBC in the bacterial infection is rocket high, but the WBC reading in parasite infection is not there. So if you see anybody coming in with a laboratory stool white count is 0 or very low, you go straight over to select your parasite options on your exam, not the bacteria. To do the ID, bacteria requires stool culture, not the gram stain. Keep that in mind, not gram stain. There is no gram stain for stool sample. Your stool is consist with gut bacteria. Gram stain will not tell you if those bacteria are good bacteria or pathogenic bad bacteria. So no. In fact, in the real life, I've seen doctors trying to order gram stain. That's not happening. We'll reject that order. You can do the stool culture. There is even specialized plate for that stool culture, like a Campi. And for the parasite infection, what you get is a white mount or OMP. That's you put the stool on the slide and then you put them under the microscope to read and trying to find if there is any eggs or larvae to read. Okay, at the end of this little video, let's do some exceptions on your exam. They almost show up on everybody's exam. First exception is the bacterial infection of E. coli. If you got the strain 0157H7, that is the one you do not have any fever, but you will have very bloody stool. Very, very bloody that literally could kill you by losing blood. That's how serious it is. The other exceptions is on the parasite side. It is the histolytica. Histolytica infections would give you absolute 0 white count. This rule is not broken. What does broken is you will get bloody stool in this one. Typically, a parasite would not give you bloody stool, but this one does because it creates ulcers on your GI tract. And this thing releases the toxins, destroy the white cells, and it eats RBC. This parasite would show RBC inside its body if being looked under the microscope. These two are the only exceptions. One broke the rule of fever and the other one broke the rule of the bloody stool. But none of them is broken the rule of white count reading. The white count reading is your savior of the exam. If you forget everything, at least remember this one. Alright, that's all I got for you in this bonus clip. You should absolutely still study each organism carefully. This is just for increase your chance of hitting the right answer during your exam when you are in a absolute confusion and just forgot everything because you are so nervous. Thank you for watching. This is Lab Rat Sherry. I'll see you in the next episode.